In this video, I'm going to tell you how to safely treat frown lines that you get in between your eyebrows. Imagine if you went to a skin clinic for a treatment for fine lines and you came out blind in one eye. How could that ever happen? Believe it or not, it happened to this young woman here.
I feel like talking about this makes it real, so I didn't want to do this, but I permanently lost my vision in my left eye after a skin treatment in Korea.
It's hard to talk about something that seems so unbelievable, and yet it's important. In this video, I will tell you what you can do to help prevent something like this from happening to you. Because it's 2 millimeters. 2 millimeters. That is the distance between looking 10 years younger and going permanently blind in one eye. Those vertical lines between your eyebrows, the ones that make you look angry or tired, even if you might not necessarily be feeling that way inside, that's one of the most common cosmetic concerns for people that come into my practice. And for good reason. Everybody wants them gone. But here's the problem. The most popular treatments that people are choosing, one can blind you, the other one can cause permanent numbness, and another one that's really popular on social media can actually make the whole problem worse. I'm Dr. Kian Eftekhari, and I'm a board-certified eye surgeon specializing in eyelid plastic surgery. Today I'm going to explain which treatments to avoid, how they are dangerous, and what you can do to safely and effectively treat these areas if you get those lines in between your eyebrows. But first, you need to understand what's really going on under your skin. Because if you understand the anatomy, you understand everything. Remember that for a little bit later. So let's start with what causes these lines. The glabella, the area between the eyebrow, is made up of a set of muscles, but the most important one is called the corrugator muscle. Anytime you frown, make an angry face, squint, grimace, those movements are going to cause the corrugator muscle to go inwards and downwards, which is going to make normally two lines in your forehead that we call the 11 lines colloquially. In your 20s and 30s, these lines only might appear when you're actively frowning. You frown, you get the lines, you stop frowning, they go away and disappear. It's not really a big deal. Those are called dynamic lines when they're only with certain movements. But here's where things change. Over time, with sun damage and aging and loss of collagen, those lines that can go away when you stop frowning become more permanently etched in your skin, even when you're not making those facial expressions. So when you're at rest, it just looks like you're angry all the time. Those are the ones we're all trying to avoid. Those are called static lines because they're there kind of all the time. How deep they get depends on several factors: genetics, sun exposure, how expressive you are, cigarette smoking, altitude that you live at, those kinds of things. Probably one of the most important things is it depends on your skincare routine or lack thereof. Now, once you've got static lines, those are very, very hard to reverse. That's why I would argue that you kind of want to know about this problem before you get to that point and start actively trying to do things to prevent it if you care about having wrinkles in your face. But I cannot stress this enough. The first thing that people usually reach for to fix these lines is the exact thing they should not be doing. And that thing is dermal filler. Filler is everywhere. I need you to hear me on this. Do not get filler injected in between your eyebrows into the glabellar area for those lines. Just do not do it. Dermal fillers are incredibly popular and they are useful for certain things, whether it's giving a little bit more volume to the cheeks or to the lips. Some people do it under the eyes. I don't recommend that. I'll tell you why at some point. But here's what people don't really know. The glabella, the center of the forehead, is the one area of the face where you can have catastrophic complications from filler. Here's the reason. It's blood vessel anatomy. Blood vessels that supply your scalp and your face run right through this area. In fact, scientific studies on cadavers have shown that where those blood vessels are is usually at the exact spot where people form wrinkles in that area. So when I said 2 millimeters earlier, if you remember that, I mean that there's about a 2 millimeter depth between where that wrinkle is at its deepest point and the blood vessel right underneath it. That's not very much of a margin for error. So when you try to fill that area with filler, you could actually inject filler into an artery. So that's called a retinal artery occlusion, a blockage of that artery. I want to emphasize this very clearly. This is almost never reversible. There is no antidote that can make the blood supply of the retina work after it's been deprived of that blood supply for a few minutes. So think about it this way, you're going in to get some fine lines treated and you come out blind. That is just not worth it in my opinion. The medical literature has documented many cases of blindness from facial filler, and the most high-risk zone is right here in the center of the face, the glabella. Even when performed by experienced injectors using proper techniques, there is still a risk of this happening because all of us have slight variations in our anatomy. Wait, what's that? I'm getting canceled by the filler companies? Yeah, I really don't care. So that's filler. It's off the table for this area. Now there's also a surgery to fix this that sounds like a logical solution, but here's the problem with that approach. The surgery is a surgery that actually removes, meaning cuts out the muscles in the center of the forehead. You might hear it called a corrugator removal or a myectomy, and it's usually done in the context of a forehead lift, using small cameras to get in there and cut those muscles out. The concept sounds logical. If it's the muscle that's causing that line to form, then if you just remove the muscle, it gets rid of the lines. Sounds great, right? But here's the problem with that. The corrugator muscles, those muscles we talked about, lie very close to sensory nerves here and here. So what's a sensory nerve? A sensory nerve is what provides feeling to your face and your forehead. A motor nerve is a different kind of nerve that helps you move your face. If you damage one of these sensory nerves, it can cause permanent numbness all the way back to the back of your scalp because the nerve originates here and goes all the way back to here. This is a very real risk of this surgery. I have done this surgery myself, and removing those muscles carefully without injuring that nerve requires a lot of technical precision and a little bit of luck. Now you might say, hey, numbness isn't so bad, now I won't get headaches anymore. But it's just not that simple. The second problem with removing these muscles is that it can cause hollowing in the inner eyebrow region. Now, hollowing in the inner eyebrow region can aesthetically just look a little kind of gaunt and hollowed out. It's not the prettiest feature. I think it contributes sometimes to the feeling that people look like they're sort of deer in the headlights after a brow lift. That's the emotion that they convey, and most people are not looking for that outcome aesthetically. Even if you have muscle resection, if you had those things we talked about earlier called static lines where they're permanently etched into the skin, taking out the muscle that removes those lines is not necessarily going to get rid of the line completely, so it might be an incomplete solution even if it goes well. You should know these risks. It's not the first line treatment, and I really don't think it's the best solution to fix this area. Now at this point you might be thinking, okay, filler is dangerous, surgery is risky, but what about all those people on social media that are telling me to make faces where I'm like massaging my forehead, puffing out my cheeks, squinting and relaxing? Isn't that just going to fix all the lines in my face? There's all kinds of names for this. Face yoga, face aerobics, eyelid exercises, or sometimes even sticky patches that you put on your forehead overnight to help kind of prevent those lines from deepening. I'm going to be honest with you, these things don't work. And in actuality, some of them can make the problem worse. The influencers that are promoting these sorts of things either don't really understand the anatomy, or worse, they stand to profit from you purchasing some of these products. Let me explain why. Your glabellar lines are formed after years and decades of making facial expressions, losing collagen over time, having sun exposure, maybe having a smoking history. The idea that you can just massage or exercise these lines out of the way fundamentally misunderstands the problem. It is my belief that face yoga and facial exercises that tell you to strengthen these muscles can actually make the problem worse. When you're doing these exercises, you're actively contracting the muscles that make these lines in the first place. You're literally practicing the movement that causes the problem. That's like saying that you can eliminate smile lines, the lines that form at the corner of your eyes, by smiling more. The logic just doesn't really add up. Another analogy would be like if somebody told me that making a fist or moving my fingers would make the lines in my palm go away. Would that make any sense at all? If these methods actually worked, we would not have a multi-billion-dollar industry centered around neurotoxin, injecting Botox and things like that into your face. And trust me, if face massage could replace Botox, I'd be teaching all of my patients how to do it because it would save them a lot of money. So if filler can blind you, surgery has all these risks, and facial exercises are kind of bogus, well then what treatments actually work to fix these lines in the forehead? The gold standard evidence-based treatment for fixing these vertical lines that you get in your glabella is something called neurotoxin. Common brand names for that: Botox, Dysport, Xeomin, Jeuveau, Letybo. Those are the medications that are FDA approved to treat these lines. So let's say you inject neurotoxin into the corrugator muscles and the other muscle in the center, something called the procerus. When you do that, they can't make those forcible contractions as strongly, so you're not able to physically make those deep lines, and then they are less likely to get etched in. This is a great treatment for dynamic lines, which is why a lot of people start things like neurotoxin earlier, whereas if you have static lines where they're permanently etched in, the neurotoxin can improve them, but it's not going to make them completely go away. Here's the key to going this route. Start early. If you're thinking this is something important to you, then starting neurotoxin earlier can prevent those dynamic lines, the ones that happen when you move your face, from turning into static lines and being permanently etched in your skin down the road. The procedure takes like 10 minutes, it's FDA approved, and it is the gold standard for treating this area, and typically the effect lasts 3, sometimes 4 months. The safety profile of neurotoxin is excellent, but what are the downsides? Well, mainly cost. It's expensive. It's expensive to get these injections, and that's the annoying part. And that's why people are always searching for easier and cheaper solutions for this. So I get it. The other downside is that it is an injection, and some people are a little bit freaked out about that. In my practice, we use a massaging, vibrating roller when I do these injections to make it more comfortable. Nevertheless, it's not the most fun thing to get pricked in the face a bunch of times. From a skincare perspective, something with retinoic acid or a retinoid is your best friend for trying to maintain your collagen in your skin so it doesn't necessarily form those fine lines over time. Skincare is a long-term investment. It's not something that's going to improve things overnight. If you're looking for a faster solution, neurotoxin works anywhere from 3 to 14 days after it's injected. Skincare, we're talking about years. If you have static lines, those ones that are permanently etched in, then there are some options for more aggressive treatments like lasers that can help tighten some of the skin and resurface it. These are going to involve maybe about a week of downtime and certainly some cost, but it is a different solution that's going to be a lot safer than things like surgery or especially filler. The key is that these treatments address the skin envelope itself. Neurotoxin can work on the muscle underneath. Skincare and lasers can work on the skin. It's not worth it to try more dramatic things like surgery or fillers. So to recap, don't waste your time and money on face yoga or eyelid exercises. They don't address the underlying problem, and they can actually make things worse. Avoid filler in the glabellar area because it can cause blindness. So consider yourself warned. And think carefully before pursuing a surgery to remove these muscles because it can cause numbness and hollowing of that area. I would recommend embracing neurotoxin as your first line defense along with a good skincare regimen. Your frown lines sit on top of some of the most dangerous anatomy in the body. 2 millimeters is that distance between the artery and the bottom of that wrinkle. So I don't think it's worth taking the risk on something like filler, even though it seems like a quick and easy solution to fix this, because it can result in devastating complications like permanent blindness in the eye. In a world where social media is trying to sell you things constantly, and medical spas or injection facilities are trying to encourage you to try some of these different treatments, the best thing that you can do to protect yourself isn't a product, it's information. If you found this video helpful, please hit the subscribe button and give me a thumbs up on this video. If you like learning content about eyelid and facial anatomy and surgical and cosmetic rejuvenation, check out my other videos on my channel. And remember, always seek treatment from qualified, experienced providers before undergoing any kind of medical treatment around the face. Thanks for watching, and I'll see you in the next video.